Hi, I'm Morgan Gable in the Advocacy Department here at ASA. We hope that the holidays provided a lot of rest and relaxation to all of you so that you're ready and raring to go with us again this year. The end of the year finished with an unusual flurry of congressional and federal government activity, and one of the most important accomplishments directly affects many ASA HCBS providers. ASA at the national level and you, ASA members at the grassroots level, were involved in a dizzying last-minute effort to encourage the Centers for Medicare and Medicaid Services to delay the implementation of the January 1st, 2011 Medicare Hospice and Home Health face-to-face visit rule. We heard from many members that implementing this rule on January 1 would be impossible for a variety of reasons. Our rural members expressed particular concern that implementing this rule on this timetable was just not feasible given the many barriers that rural providers face. Many home health providers worried that physicians would simply stop referring patients to home health given the hefty new requirements. Along with more than 30 other organizations, including the National Association of Home Care and Hospice and the Visiting Nurse Associations of America, we convinced CMS to delay enforcement of the home health and hospice face-to-face encounter requirement until April 1st, although the January 1 implementation date remains in place. The decision was based on a concern that beneficiaries might not be able to access care while physicians and providers prepare for this policy change. We have just learned that CMS will be calling a meeting with stakeholders over the next few weeks in order to gather suggestions for working through this transitional time. The goal right now is to institute effective educational strategies for proper implementation of this new requirement. Advocates have mentioned that if this strategy does not go well, that another postponement and possible legislative action may be required. However, it is important to note that the face-to-face policy is popular with staff on both sides of the aisle on the Hill, so those options may not be possible. ASA will be sharing information that can help you work with physicians, hospitals, and other aging and disability service groups to assure that the face-to-face requirement does not become a barrier for access to these vital services. Education will be necessary on multiple fronts. First, doctors will need to be reminded about the new face-to-face requirement. And second, possibly a more critical item, an educational effort will need to be launched to explain the documentation requirements that will have to be fulfilled by physicians. So, stay tuned for more information on how to navigate this complex new rule. We appreciate your advocacy and support on this important issue, and we will continue to be involved in meeting with agency officials and with staff on the Hill in order to help them understand what must be done in order for a new requirement like this to not negatively affect Medicare home health providers and Medicare home health beneficiaries. As we begin 2011, we wish a Happy New Year to you all. This is our last ASA HCBS video, but we know that you will be counting down the minutes until you receive your first ever Leading Age HCBS video next month as we continue to inspire, serve, and advocate for you and the older adults that you serve.